We were talking about the Low Cost Therapy NYC website, which is something we actually had a university about this with Anna Nathanson, who is a licensed clinical social worker. I wanted to revisit this for a couple reasons. One of which is that I think it's just helpful to know where to look for mental health resources, especially low cost or free mental health resources. As many of you know, it can be really difficult to find mental health support that is affordable. And I think that this website is really helpful in putting a lot of those resources in one place. Another reason is that there have been some updates to the website as well. I think it's a little bit easier to look at on your phone. I'm going to be sharing my screen on my computer just because I think it's easier for you to see. But I think it's a little bit more accessible on the phone than it was before. You don't have to shrink it down in the same way. Also, the way things are sort of categorized is a little bit different. So we'll look at that too. And I know that mental health is like a big need for lots of people right now. So I just want to make sure that we have all the tools we need to navigate this site and find resources. I'm also going to talk a little bit about one of the resources in particular that's on this site, which is 988, which is the mental health crisis line, but it can also be used to get referrals to other mental health services as well. It's used for mental health crises and also just ongoing referrals. So we'll talk about that a little bit more as well. So this is the Low Cost Therapy in New York City website. It was made by Anna Nathanson, and I think her father is the one that designed the website. And the point of this is to make it easier for you to access low cost and free mental health services, considering mental health services can be hard to find and also very expensive. The services that are listed on this site fall under one of these categories, right? Some of them offer sliding scale, so services for under $50 or even free services. Some of them accept Medicaid and or Medicare, and then some accept private insurance. There'll be stipulations about, how that private insurance helps to make, these more low cost. A lot of these, the focus is on free or sliding scale or places that take Medicaid or Medicare. This is just information about if you have a listing to add or something like that, you can reach out to Anna herself. They've added this link that's about the mental health resources that are available to everyone. So these are more like activist communities that are calling for greater access to mental health services. So this is more like places where you can advocate for widespread availability of mental health services. These links here are for people who actually are coming to this website with, a large amount of funds and want to support other people who are maybe not as well funded in trying to access mental health services. But if you keep scrolling down, you'll get to, I think this is sort of the heart of this website. The listings on here are grouped by these categories of what kind of clinics or what kind of resource this is. So there's a couple of different things to choose from, and you can go through this list. It's one page. You can scroll down and look through it to see what might work for you in any of these categories. If you're very interested in one of these categories in particular, like graduate school clinic, you can click on that and it'll take you directly to all the listings that fall under that graduate school clinic heading. So the things that we have here are graduate school clinics where you can get low cost care because the people who are providing that care are currently studying to be therapists. They're in graduate school study. So they're at the early stage of their career and therefore are offering services at a lower cost. This can be a really good option. I've actually used this in the past, and I can't speak for all services that are like this, but I had a really good experience with someone who was in training and who I've continued to see, for many years after. Training institutes are going to be similar to that. They're not necessarily a university, but they're a center where people who are currently training to be therapists are practicing for lower cost. Hospital outpatient services. So there are low cost and sliding scale programs that operate out of hospitals. And there's a likelihood too, related to hospitals, they might have a larger array of language capabilities in terms of offering therapy. So that's something to look for if you're looking for therapy in a language other than English. Community health clinics and nonprofits. So a lot of these take a variety of insurance, including Medicaid and Medicare. They're generally run by nonprofits, and sometimes case management is available in those same locations. There are also private group practices, so practices that are just run by a group of therapists, but they may offer sliding scale. Psychiatric services that include prescriptions and medication management. So if that's something that you're looking for in particular, you can click on this in order to see those. Hotlines are one that I want to talk about too. So again, we're going to talk about 988, and I'll talk about that a bit. But hotlines are always free. right? Unless otherwise noted, but generally speaking, hotlines, the whole point is that you have someone that you can talk to immediately and that they can help you get connected to further resources for ongoing care. So I think those are really useful places to start, as well as this website. And then there are community groups that are maybe run by peers and that focus on specific mental health concerns. So you can click on that if you're interested in those. And then these directories and therapy matchmaking services. This can be a whole range of costs, but it's people that will help connect you to a therapist that is, sort of within the range of what you're looking for. Maybe that they have certain characteristics that you would like to have in your therapist, or they do a certain kind of therapy. So that's another option as well. We'll look at these in just a minute, but I also want to just point out that a lot of therapists accept out-of-network benefits if you have insurance. It's always worth checking too with your insurance who's in network for you. So you may end up paying a very small copay if you have insurance, or like no copay at all if you're seeing someone who's within your insurance network. That's kind of a whole can of worms itself. But if you are trying to get somebody within your insurance network, it's worth talking to your insurance company or going on your insurance company's website to see a list of providers that they actually work directly with. It's easier if your insurance covers therapy because you'll just have a standard copay that you're paying every time. Out-of-network benefits can be a little bit more difficult, which isn't to say that you shouldn't make use of them if you can, but that's one thing. And if you're uninsured or if you have Medicaid or Medicare, there are going to be options that are available to you specifically that come from the sliding scale or just, identification of particular needs in the community that will make these services low cost or free in some cases. Let's look at Training Institute. Okay, so you click on Training Institute. What it's going to do is take you directly to the section of the website where the training institutes are listed. All right, so let's just scroll down and look at one in particular. I'm going to look at one that I've actually had some in. So the Institute for Contemporary Psychotherapy, we can look at this. This is going to be a link directly to their website to get more information. All of these bolded headings are going to go directly to the website of the place itself. So the Institute for Contemporary Psychotherapy is Upper West Side. You can see a little bit of information about them. It's a nonprofit that does mental health training and treatment, and you can see that they take a wide range of insurance. So Medicaid, Health First Medicaid. This might be an option for you if you have any of these kinds of insurance. I know that they also do some sliding scale as well, so worth looking at that. But if you want to keep looking along the way, let's say that you're looking specifically for something related to, post-traumatic stress, maybe. If that stands out for you as something that a particular facility specializes in, it may be worth checking with them. And you'll see on this one, they accept a range of insurance, but they also have a sliding scale rate. They have a student rate as well. And there is a wide range of available resources on here. So it's a pretty comprehensive list. And all of these worth checking out. It's always possible too that you can get in touch with these and they don't have current openings. So it's good to have a couple places that seem like they might be a good fit for you. And a lot of them will have you do an intake appointment just to get a sense of what it is you're looking to work on in therapy. So let me scroll back up. So if you're in a section and you want to go back up to that main menu, just scroll all the way up, go back up to the top. So I want to look now at private group practices really quick. So these are small-ish group practices. There's not tons of these that provide therapy at sliding scale rate. So worth checking those out as well. They probably also take out-of-network benefits, and you might need to show a proof of income from that in order to qualify for sliding scale. So generally speaking, they ask for, recent tax forms or something like that just show what your income is, or maybe if you're receiving benefits, just so they know how to sort of adjust your sliding scale. Scroll back up again. Okay, I wanted to talk about hotlines. So again, like we were saying, hotlines can be really helpful. I think we think of them as for use during crisis only. That's not necessarily the case with some of them, especially this 988 one that I'm going to tell you about. It's definitely something you can use in times of mental health crisis, but you can also use it just to say, I'm feeling depressed and I would like to get some, information about how I might get low-cost therapy for depression. You don't have to be in a state of emergency in order to give them a call and ask for resources. There's actually a large range of different hotlines that specialize with different populations. So like there's a National Deaf Domestic Violence hotline, a Native helpline. There's many hotlines that are in Spanish too. 988, we'll see, also offers services in Spanish. Asian American Suicide Prevention. So that hotline's available in Cantonese, Mandarin, Japanese, Korean, and Fujianese. So language options here. Okay, the thing that I wanted to look at right now with you is NYC Well. So you may have heard about this, that there's a number 988 that is now sort of the mental health crisis line, for lack of a better word, but also just helpline, I think is probably the best way to say it. So we're going to click on that just to go directly to learn a little bit more about that. I think this is a good resource to just have on hand if you need it. This is 988 Suicide and Crisis Lifeline. So what this is it's a tool where you can, for no cost, connect directly by text, phone, or chat with a trained therapist who can either help you with a current crisis or can talk you through what your current issues are and try and help you find resources that fit your needs. It's a great thing to have available, especially as it can be really difficult sometimes to navigate the environment of mental health services. It can be real complicated. You'll see that it's available in a number of different languages. I know that they do text, talk, and chat in Spanish. I think they have also language assistance for other languages as well. What you would do from here, and assuming you're on your phone, any of these would connect via your phone. So you can text, so you can have a conversation via text with a counselor. You can call them directly by just dialing 988, or you can do a chat that's like a chat window in your browser. You can do that on your phone, but you could also do that if you're on a laptop or a tablet or anything like that as well that can't make outside calls. So these are the things that they offer. So assistance with suicide prevention and crisis counseling. So again, that's the crisis part of it. This thing that they call warm transfers, which is basically them helping you access these resources and giving you a referral to a therapist or other program that might be able to assist you long term. And then follow-up care. So they'll check back with you to see if you've been able to connect to care based on the referrals that they've provided. You can also look up services yourself from here. So a similar kind of tool to the low-cost therapy one. Keep an eye on what insurance covers what and what might be available to you. It may be helpful to actually talk to somebody to get them to help you navigate those services. There's also an app library, so that's kind of cool. There's a lot of free apps that you can download that just sort of assist with mental health. Not necessarily what you want to use in the moment of a crisis, but as an ongoing sort of tool in the kind of kit of things you use to take care of your mental health, these can be great. If you ever are worried about like immediate risk of harm to themselves or others, they'll ask you to call 911, but 988 is when, you know, you're sort of either looking for resources or in the midst of feeling like you don't know where else to go with that. I wanted to show you FAQ. All right, so just what happens when you contact NYC 988? I just want to give you that information. So again, a trained counselor or peer support specialist will help you through that and help you get referrals to ongoing services. So, okay, you can press 2 or text ayuda for Spanish, but they also have free interpretation for over 200 languages otherwise. So if you can just say that that's something that you need when you call, you can do that. And I wanted to point out too that phone calls, chats, and texts are confidential. The only case where that is not true is if there's a threat or risk of harm to yourself or others, where they may need to share that information with someone in order to just keep everybody safe. And you'll see too that when you go to do the talk, text, or chat, they're going to ask you a couple questions to start with. Either they'll be typed out if it's text or chat, or you can answer it when you talk to, just about your age, what you're concerned about, and that helps get you to the right kind of staff member in that moment to help you with what you're looking for. So that's 988. I think that's a really good one to just know. They have a lot of information that they can help you with on a one-to-one basis. And then again, going back to also the low-cost therapy website as a really good sort of directory of a lot of these with a focus on free, low-cost, and sliding scale therapy. Wanted to give you these tools to have on hand for yourself too.